All right, John, of course, on vacation. That means I get our special guest all to myself. That is, it's a thrill to talk with Dr. Rob Amrine. He's board-certified, fellowship-trained sports medicine doctor. And this is really exciting, Rob. First of all, welcome to Health Talk. Good to see you.
Thank you. Thank you for having me on the show this morning.
Let's just get you a little bit closer. There we go. That's good. All right. Now, tell me a little bit about Rob Amrine. Where'd you come from? How long you been in Missoula?
I was born here in Missoula, Montana, and
Wow.
went to high school in Hamilton. Went to the University of Washington for all my schooling and moved back to Missoula about 6 years ago.
Okay. Now, you are a sports medicine doctor.
That's
right?
correct.
So how did you get involved in that?
I first initially got in sports medicine trying to make the human body bigger, faster, stronger, how to perform better in sports, and over time realized that...
How am I doing over here?
Yeah, exactly. You're doing wonderfully.
Peter, you're just older.
Yeah, you do more push-ups and sit-ups, and we all do better.
Go ahead, yeah.
But I think that just trying to make the body a little bit faster, and over time I realized that the body does a very good job of being fast, and we just need to help keep it healthy through our sports endeavors.
Okay, so when you say that, what I hear you saying is you're much more into prevention now than performance. Is that right?
Exactly. I think that over time, as my ideal of trying to make a human body perform better is more to the willpower of the patient or the athlete. But now I think our biggest strive is how do we prevent people from coming to see me? My ultimate goal is to be unemployed at some day. It just isn't happening quite yet.
Now, one of the most powerful movies I saw in the last several years was Concussion, with Will Smith. Did you have a chance to see that?
I've seen snippets of it. I'm pretty familiar with the protagonist in that movie and
Right.
his research, but haven't seen the whole movie yet.
Well, I would recommend it because it's extremely powerful, and especially the way he had to be incredibly persistent as the worlds of sport and football, professional football, came down on him, like a ton of bricks, quite literally. But he kept with it, and eventually the Players Association and the players themselves began to understand, this is why I'm not feeling well. This is why after my career is over, my life is going downhill in a big hurry, right?
I agree. The perception of injury in sport has drastically changed over the past 20 to 30 years. Our days of rubbing some dirt on it and toughening up are evolving slightly, although that's a big component of it still. But we're trying to be smarter, not just tougher.
Okay. Now, I understand you deal with high school kids?
That's correct. I treat all ages of athletes, but a good proportion of them are high school athletes.
And they actually come to you for physicals, right?
That's correct. That's correct.
So how has that process changed over the years? I remember when I was a junior high, I came in for a physical, and it was, yeah, you look okay, get out of here.
Yeah, it has evolved from that day. I think that my stepfather, who's a veterinarian, signed off on most of my physical exams. So it's changed. Now we're looking more at trying to ferret out risk factors that put an athlete at a higher risk of catastrophic outcomes. So the biggest things that we're really looking at now is education in head injuries and concussion, as well as talking more about cardiovascular risk factors, kind of those worrisome things that are the one in a million, but we don't want those to happen.
So what are some of those worrisome things that you want to make sure that when a young man or young woman comes to you, what kind of examination do you do, or are you allowed to be really thorough and comprehensive?
In my opinion, I think the sports physical exam should be extremely thorough and extremely comprehensive, going all the way from immunizations to preventive health, discussing about drugs and sex and rock and roll, all those aspects of life, but also trying to find a good family history, talking about family history of heart disease or stroke or sudden death, so that hopefully we can pick up that one risk factor that may be something that keeps a child from being like Hank Gathers, the famous guard for Loyola Marymount, who passed out on the basketball court and unfortunately died at that time period. So those are the type of things that we're really trying to pick up in our sports physical exams. So
when you talk with someone, are there little bells and whistles that go off in your head? And if so, when does that happen?
Absolutely. Any person with a family history of cardiovascular disease or heart disease, I'm much more inquisitive with them about their history as an individual athlete. Any athlete that's ever passed out for any reason, I spend much more time talking to them about why they passed out. I think a lot of times we blame passing out on dehydration, and I think that's does happen, but it's so rare that dehydration is the full reasoning for the passing out. I think we have to look a little deeper and figure out why they truly passed out.
Now, there is a culture, I guess, especially in high school football, when you got to be tough, you got to get in there. You know, if you want to play, even if you're maybe you got some bumps and bruises, you say, "I'm okay, coach, put me in." How do you deal with that sort of philosophy?
I love toughness. I strive for toughness in myself, which I don't have much of. But I do believe that we all need to be tough, but we need to be smart and tough, not dumb and tough. And there's a lot of times where if we're smart and talk to our athletic trainers, talk to our coaches, talk to our sports medicine doctors that may be helping us, and allowing them to guide us as athletes into when it's okay to truly be tough and rub some dirt on it versus when it's okay to sit out a play or two and get healthy.
Now, you're obviously working with the kids. Are you also working with the coaches and the parents and all the folks who are involved with these kids?
We work with everybody, and I think this is a team aspect, and sports medicine and medicine altogether is just like our team sports. We all have to work together to get the best outcomes. And so if the coaches are on board with me, if they're on board with the athletic trainers, and we're on board and understand the goals of the coaches, we have a much more successful athlete, a much more successful team, and the outcomes on the field are really shown.
The kids that I've talked to who, especially football players or especially college basketball players, they take great pride in their strength, in their agility, in their endurance. But the one thing they can't control is knees and ankles.
Right.
So I remember last year when Coach Shannon Schwain took over from Robin Selvig, and the first day of practice, she had 3 of her starters go down with season-ending knee injuries. Tell me about that. Why that happens, and or is there a why?
I think there is a why that, unfortunately, just like coming back to my original reasoning for getting into sports medicine was trying to make the human machine bigger, faster, stronger. Well, the human body is a machine, and just like any of our vehicles that we drive and any of our race cars that we drive, things break. And they don't always break because we want them to. They break because we push our bodies, we push our machines to the ultimate level. And at that ultimate level, sometimes we stress them too much and they don't work quite like we want.
Can you explain why the knee is such a problem area with athletes? I realize, the entire weight of the body is on that, especially when you go in a different direction or up or down or back or forth or what? How does that work?
There's many aspects that go into why the knee is so problematic. One is it's kind of hung out there all by itself in space, and for a lot of other components of your sport, whether it's an individual sport where you're falling or whether it's a team sport where you have competitors that are landing on your knee that are forcing the knee into different directions where it's unprotected. And then there's a lot of dynamic aspects of the knee where the knee's moving all by itself, and as you're changing directions, the knee wants to go one way where you're trying to force it to go the other direction. And unfortunately, there's one infamous ligament called the ACL, the anterior cruciate ligament, that has caused Coach Schwain a lot of grief in the last 12 months.
So could you, we're almost up against a break, but could you describe what the ACL and the MCL do? Obviously, hopefully they work together, right? They're supposed to.
Correct. The ACL is inside the knee, and its job is to help keep the lower leg from shifting forward and helping also provide a little bit of rotational support. And it has a little bit more of a complex role in the knee. And the medial collateral ligament, or the MCL, is on the inside of the knee, kind of on where your knees would touch together. And its job is just simply to keep the lower leg from bending outwards. And they do function together, and at very high-level injuries, they can tear together, but rarely do they actually come to that level.
All right. We're going to come right back. By the way, if you have a question for Dr. Rob Amrine, he's a board-certified, fellowship-trained sports medicine physician. He's here in our studio to answer your questions. Got a pair of headphones just for him. 721-1290 is our number. We'd love to hear from you here on Health Talk. We'll be right back. We're back on Health Talk. 721-1290 is our number. 1-800-568-5309. Dr. Rob Amrine joining us this morning, talking about sports medicine. Now, I'm sure this happens to you in the grocery store all the time, right? People discover you're a doctor and say, hey, it hurts when I do this. And you say,
you bet. We talk a lot about it.
Don't do that.
Well, I try not to say that too often.
Okay,
but,
all right. So
I don't have much to talk about in the world, and what I know most about is sports medicine. So it makes me very happy to talk about it.
So it does. Okay, good. So folks can approach you and say, "Hey, doctor, I was running around, I was playing tennis, and I slipped and fell, and now this doesn't work right, or whatever." And you can say, well, you probably should see your physician about that, right?
Exactly. I'll give you my politically correct statement if I don't know you. And if I know you, you sometimes have to be careful of the advice I give you.
Gotcha. All right. Let's talk about youth sports. And parents are really excited these days about making sure that their kids get a well-rounded athletic education, if you will. So they want to get them involved in all sorts of things, in soccer or football or basketball or swimming or whatever. Is it wise to have especially younger kids involved in so many different sports, or should they be focusing on one?
I think a multidisciplinary approach, or playing multiple sports but only one sport at one time, is really important. We've seen through the past years that an athlete that focuses on one sport actually has a much higher risk of injury and actually has a much higher risk of stopping that sport due to either emotional burnout or stress or whatever the reason may be. But very few one-sport athletes continue to play that sport when it comes to high school.
Really?
And the risk factor for injury is estimated anywhere from 4 to 8 times higher in one-sport athletes in high school than a multidisciplinary sport athletes, such as football, baseball, basketball.
Why is that?
I think the best theory on it is that the athlete becomes so trained in that one movement, that one part of their sport, that they overuse their body parts that is demanding in that sport, and that body part eventually gives up. A good example is the throwing elbow. So little leaguer's elbow, little leaguer's shoulder. Those athletes throw so much, then that body part is really not meant to have that stress on their elbow or their shoulder.
Now, is that because especially the little guys, they're still growing, right? Their joints and everything are all growing and trying to fit together. And I'm sure if you abuse it, then you can interrupt that process.
Absolutely, and I think that's the big idea that we have to really address as coaches, as fans of the sport, is that a 12-year-old is not an 18-year-old, and an 18-year-old is not a 25-year-old. And there's a difference between how some kids grow. There's guys like LeBron James, who at age 14 looked like he was an adult man, and then there's guys like me at age 14 and also at age 25 that looked like I was still 12 years old. So we have to be careful on how we train somebody based on what they look like and actually what their actual age is.
How can parents, I'm sure that kids, especially once you get involved in a team sport, it's very addictive because they're your buddies, they're your team, they're kind of your family, and you want to come through for them. You don't want to let them down. How can parents be a positive support and help the kid to look out for themselves a little bit too?
I think it's making sure that as parents, as fans of the sport, that we make sure that we know what our agenda is as the fan or the parent. And as a good friend, a former president of the American Medical Society of Sports Medicine, says, whenever we place "we" in our weekend of playing soccer, we start to run down a slippery slope because we start to get confused on what our agenda is. And that's where we really want to look out and make sure that kid's having fun, that kid is out there enjoying the process, but we're not putting undue pressure on them of what we think is the correct aspect for an adult participant in a sport.
So how do you know if a kid is overtraining or not? I realize some kids just have a natural gift, athletic gift, to be able to do certain things. How can you tell when they're overtraining themselves?
I agree that it's really difficult to try to see if they're overtrained or getting tired or getting fatigued. But oftentimes we'll start to notice that kid's coming home and asking for ibuprofen or asking for Tylenol or asking for a back massage or ice bags. And if you really kind of step back and start thinking about it, should a 12-year-old, should a 10-year-old be asking for pain medicine? And I think that's where we have to look as a broader spectrum of our youth athletics. If we're asking for pain medicine at that young age, then I think we're starting to push that kid a little bit hard.
So when you see a movie like Rudy, okay, and this kid was the, if you will, the ultimate warrior when it comes to a little kid who wanted to play for Notre Dame. He got on the practice squad and eventually was carried off, the field because of his performance. He got beat up every single day and was injured all the time. So when you see something like that, does that inspire you, or does it say, hold on, there's got to be some more wisdom here somewhere?
I think it inspires me and it gets me really excited. I remember watching Rudy and going straight out to football practice right afterwards and probably beating myself up and now regretting it a little bit. But I think that those are great stories and great willpower stories to have our young people look at. But I also think it's really important as guiding physicians, athletic trainers, coaches, parents, that we all put our foot in every once in a while and ask those kids to take a break, to go to the lake or go fishing or go hiking, do something besides their competitive sport.
Or just rest.
Yeah, simply rest. It's okay to chill out every once in a while.
Sure. Now, I understand that you're also the medical doctor for the Missoula Marathon. How did that come about?
Basically, I went to Runner's Edge and begged and pleaded and told them I'd buy a pair of shoes every week for the rest of my life. And when they got tired of it, they let me be the medical director. Actually, when I moved back to town, it was just the perfect timing. The previous physician that was in charge of it had done his duty there and asked me if I'd take over, and it was a nice fit.
Well, these are my Runner's Edge shoes.
Excellent.
And my wife and I have already done the bank run. Is it the bank run? The riverbank run.
Yep.
And so now,
YMCA.
and so I have I think 4 different colors of T-shirts for the Missoula Marathon. I was hoping to get into the half marathon, but we're settling for the 5K. So
any activity in the Missoula Marathon is absolutely wonderful. Run Wild Missoula is a pretty magnificent group of people that sponsors many different races throughout trail runs, road runs, and really keeps the running population active in Missoula. I don't know if I've seen a community the size of Missoula have such an enthusiasm towards running. And when I speak earlier about prevention and trying to prevent my way out of a job, my biggest ideal in the world is to prevent the cardiologist out of the job. And Run Wild Missoula is doing a heck of a job keeping those cardiologists less busy. We're
going to come right back, talk more with Dr. Rob Amrine specifically about the marathon. And a lot of folks have been training for this for months because it's next month. Maybe a little late to start now, but anyway, we're going to talk with Rob, and we have all 4 lines open at 721-1290 if you'd like to talk with a sports medicine physician. He's right here in our studio at 721-1290. Okay, we're back on Health Talk. 721-1290 is our number. Dr. Rob Amrine joining us, talking about the Missoula Marathon coming up next month now. And as folks are out training, there are folks who have been actually training for this since February, right?
Yeah, a lot of people start their training programs 6 months in advance, and the slow, gradual taper up to a running race, again, tries to keep you out of my office. And this is kind of that crux time where a lot of people have hit their peaks. They've run their longest run that they're going to run before the marathon, and now they're sitting at home just keeping their legs loose and getting excited for 2 weeks away from now.
Now, why is it important to especially folks who are not competitive runners? I mean, that's a different world. But for folks who just get out there for fun and recreation, why is it important to take that time and do it right?
Yeah, the human body is a very efficient machine, and we don't want to carry around much more strength or mass than we absolutely need. And so if we're used to running only 5 miles a week, that's what our body's strength and what our body can handle. And so if we change and go from 5 miles to 20 miles in 1 week, all of a sudden our body has to play catch up to try to build that extra strength, to build that fortitude to withstand 20 miles. And unfortunately, that takes quite a bit of time to get that fortitude. And so if we jump quickly, we break. And if we break, then you're talking to me and frustrated, and that's what our goal is not to be happening. So if we slowly build up over a period of time, we can decrease our risk of those overuse injuries or those sore Achilles, sore knees, sore shoulders, etc., and keep you out playing and rather in my hands.
Now, the jump from the 5K to the half marathon, full marathon, that's a huge leap. I mean, it's for someone who's only done the 5K, is thinking about doing the half marathon, a little late now to make that jump, right?
It is, and some people can get lucky. We all have that friend that off the couch and after a night at a birthday party or two that they are able to jump into the marathon and do just fine. But they definitely will pay the piper afterwards and be sore for a while. So that slow, gradual increase from a 5K to a half marathon to a marathon, and even to races like the Rut at Big Sky, where you're running up and over the mountains and running 50 kilometers. All those are possible for people, but it's an idea of trying to find what your body fits with.
Right.
As we talked earlier, sometimes it's okay to be a really fast middle distance runner and throw down a 10K that's faster than anybody in the world. That's still something to brag about.
All right. So what advice would you give folks out there right now who have kids that are in summer sports right now, preparing for fall? What would you suggest to them so they could be safe and yet still have a good time out on the field?
Yeah, I think the best thing for every kid is watch your kid and look, and when they're tired, when they look a little beat up, it's okay to have them rest, even if it's in the middle of a competitive season. A lot of times we sign our kids up for a competitive, organized sport, and we feel that they need to stick through it just to teach them kind of life lessons of having the correct demeanor of the team sport. But I think we also have to look at our kids and make sure we don't beat them up, because a kid that's hurt isn't going to like their sport, and a kid that doesn't like their sport will quit. And we want to make sure that we keep all kids active, but also staying safe at the same time.
How about some contact information for you and for your office and the sports medicine folks over at Community?
Right, we're at Missoula Bone and Joint on Mullen Road, and our phone number is 721-4436, and I'm available quite often there. And I'm also available when you see me on the trails or see me on the roads. Give me a high five and we'll chat.
He's the handsome fellow that's in really good shape.
Yeah, you're lying.
All right. Well, you can lie about me if you want. And then we'll be even. All right. Hey, thanks for being with us, Rob. It's a pleasure.
Yeah, thank you.
And thanks for the good work you do and keeping people upright and working right.
Well, thank you very much. I'll see you guys out on the trails.
Take care. All right. That's going to do it for Health Talk. We'll be back with Dave Ramsey after the top of the hour.